Hi everyone, my name is Raegan and I'm a Master's of Public Health student at the University of Arizona. This summer, I had the opportunity to work with the Institute for Medicaid Innovation, Team Arizona Midwifery Learning Collaborative, as well as Dr. Diana Jolles to analyze some of the outcomes of Tricare beneficiaries who received care in a birth center. Tricare is a health insurance program primarily managed by the United States Department of Defense Military Health System. It provides civilian health benefits for U.S. Armed Forces military personnel, military retirees, their children, their spouses, and some members of the reserve component. The beneficiaries receive care in either the military or the civilian system, and many choose to receive pregnancy-related care at a birth center facility. A birth center is a freestanding healthcare facility that provides all sorts of pregnancy cares, including prenatal, labor and delivery, and postpartum services in the midwifery and/or wellness models of care. So the study that we conducted reviewed all of the childbearing families enrolled in care at an American Association of Birth Centers facility between 2007 and 2020. The outcomes for the Tricare beneficiaries were compared to those of childbearing persons with private or public payers within the same data set. And some of the individual outcomes that we considered included indicators for cesarean section, episiotomy, induction, transfer, breastfeeding, low APGAR scores, and low birth weight. There were also controls for certain risk factors, including the region of birth, parity, diabetes history, hypertension history, preeclampsia, substance abuse, smoking, and geographical differences. And we found that Tricare recipients had a 2.3% fewer cesarean deliveries, 1% fewer episiotomies, 2.4% fewer inductions of labor. Childbearing families that were served by this model of care achieved high quality delivery outcomes, meeting or exceeding national benchmarks. Of all the clients that enrolled in pregnancy care within the birth center practices, 85.9% of Tricare recipients gave birth in the birth center as they had intended. Recipients of private, public, or other insurance plans had lower rates of delivering in a birth center as they had intended. Postpartum outcomes, especially exclusive breastfeeding at the time of birth and at 6 weeks, were better among Tricare beneficiaries than those of private, Medicaid, or other insurance. And in conclusion, military families who chose birth center care for their pregnancy and birth experience had better outcomes than beneficiaries of other health plans and better than the US average. A major priority for the Defense Health Agency should be the expansion of access to birth center models of care, especially for families who rely on purchased care. A major focus of the US maternity care reform should also be the expansion of access to birth center models of care, especially in underserved areas. The model has demonstrated its role as a predictable and capable format of high quality healthcare, and it should be treated as such moving forward. Finally, I would like to thank Diana Jolles, my preceptor for the project, and the rest of the team over at the Institute for Medicaid Innovation, Team Arizona, for really laying the groundwork for this study to be done. And of course, the Western Regional Public Health Training Center for providing the funding for my work. Thank you.